happened when you were in urgent care?
Okay, what led me to coming in?
Yes.
I woke up that morning feeling unwell and sneezing a lot, and because of the times that we were in, COVID and stuff, I did feel like it may have been something like that. I sat down on the couch for a little while and fell asleep and woke up at about 2 in the afternoon with severe chills. Got the thermometer and I was hitting 39. So I decided, because I have other underlying issues, health issues, that I should get to hospital pretty soon. But I didn't go straight away. I sort of waited a little bit to see if I could calm it down myself, or if it just with time it would get better, but it was just getting worse. So by about 5 o'clock, I rang my neighbours. I was finding it really hard to walk at that point, and they came over and drove me to urgent care in Colwell. So I arrived there at about 5:45 and got taken in, and because I may have been a SCOVID threat, I was put into an isolated room by myself. She was the only one that was basically allowed into my room at that point in her full PPE, and she admitted me. She took vitals and what have you, and asked the usual admission questions of whether I drank alcohol, whether I smoked cigarettes, or whether I took illicit drugs, of which I said no to all of them. And from that stage I started getting treated for the temperature and for dehydration. So I was given fluids straight away, pretty much straight away. Took a little bit of time to organise it, of course. Saw her talking to the doctor outside the door and giving him a rundown basically of what I'd presented with. It became a bit complicated because I was in severe pain as well for what would eventually end up being diagnosed in Geelong as severe sepsis. So at the beginning it was severe sepsis, and I had acute pain in my lower back, which was pretty common, as I was told. And they did all the blood work tests and had to send them off for sepsis, which takes a fair bit of time to get the results back. So I wasn't treated with anything else for a couple of hours until just after 8, when I was given a Panadol. And then that didn't do anything to the pain, and I think the doctor had called Geelong Hospital, where they kind of know me at gastro, and they told them to start treating with antibiotics for an infection of unknown source. I did have leukocytes in my urine. It did look like there was a UTI, but they still wanted to do further tests because of the extreme symptoms that I had. Throughout all of that, I didn't receive any kind of pain medication other than that one Panadol, which did nothing. And so I requested for that to be reviewed, and my nurse, who was absolutely amazing, I don't think I would have got through that night without her. She kept going back to the doctor and asking him if he would review that, and would come back to me and say either no or he will come in at some point in the evening, by which stage I was in a bit of a state pain-wise. My temperature was still soaring at that point. It was heading towards 40. And I was feeling a little bit worse for wear, I guess. Yeah. Around 10 o'clock, somewhere around there, my nurse went out and requested again that it gets reviewed, and I could hear them talking, and I could hear him had an elevated voice with her, and she came back in eventually and said, he has written you up for a Nurofen, to which I responded that I couldn't take that because Nurofen was contraindicated to a condition that I have, which is esophageal varices, that I could bleed out if I took something like that. And she was a bit shocked by that. I could see in her face that she was a bit shocked by that, and she said, I'll go back. And she went back, and I think it was from that moment. I hadn't seen the doctor at any stage yet. It's past 10 o'clock, I still hadn't actually seen him. He hadn't come to me personally. And at that stage she went out to discuss with him about what I had said, and it was probably from that moment on that everything kind of changed. So my nurse came back and explained to me that she had requested that. She said that he had told her that he was very busy and that he would get to me, and she seemed to be a bit miffed by that. And I said to her that wasn't good enough, that I don't know why you would leave somebody in this much pain, lying here in this much pain, without personally reviewing it yourself, or even just acknowledging that that was quite serious pain to be in, that it was real, and maybe it should be treated, at least by looking at it, you know. She was great with listening to that, because she seemed to agree that it wasn't going in the way that she would have hoped that it was going. And she said to me that she wouldn't stop. And I told her that she was an absolute angel. That's when I first told her she was an absolute angel, because I don't know if I could have battled this in this situation of being so sick and so vulnerable, and then still having to stand up for what I thought was legitimately my very real pain needs. So eventually she went off to see him again, and I asked her, I said, can you ask him to come here and we could talk about this? And she said, I'll go and ask him. Nothing came back for about an hour until he eventually came in, and that's when things really got ugly. That's when I was lying down, and he said to me, my colleague has said to me that you want to talk to me and you have an issue about how your pain has been treated. And I said to him, I don't have an issue with it, I just have some questions about it. And he said, first he wanted to know where the pain was, and I was telling him where it was. And he said, that could be just because you've been lying on your back for that long. I said, it's been like that all day, and it's been like that since I've been here. And he read my info, and he said, you have cirrhosis? And I said, yes. And he said, how did you get that? When this question gets asked of me in hospitals, it's always thwart with how I'm going to answer that question, because I know it can go one of two ways. And at the time, I didn't have hepatitis C, but I have had hepatitis C, and I have advanced liver disease because of hepatitis C. I cleared that virus in 2016, but I still had to answer that question of how did I get cirrhosis. Basically, I understood that is you have to determine whether it's an alcohol related or if it's an illness related, like hemochromatosis or something like that, haemophilia, or is it because of a viral hepatitis? And so I said to him, I had hepatitis C, and I could see his demeanour change with me, and he said to me, there was a lull, as if he was weighing up where to go, how far to take the questioning, and then he said, and how did you get that? And that's where I know from experience I've had before that when the questioning gets beyond what is the cause of your liver disease and it goes to and how did you get that, that generally means insert judgment here, because that is what I've experienced in the past. But I didn't go in assuming anything about his questioning, because I always give people the benefit of the doubt because I don't want it to be that. So I hope that it's not that. But it became pretty evident to me that he was uncomfortable with the fact that I was someone that could have had hepatitis C and what that could possibly mean. And I said to him, can I ask you a question? And he said yes. And I said, do you have an issue with me having cirrhosis, treating my pain because I have cirrhosis? And he said, no. And he said, why? And I said, do you have an issue with me once having hepatitis C? Is that impacting whether you're going to treat the pain or not? Does that have some impact? And he didn't respond no. His immediate response was, how dare you accuse me of not doing my job properly? How dare you accuse me of being prejudiced? And I took a deep breath because I actually didn't see it going that way. And I said, I didn't accuse you of anything. I just asked you a question. And he said, no, you didn't. You accused me of not doing my job. And that's where we continued to discuss what was an accusation and what was a question. And he said he got quite loud, and I do have this vision of him leaning over me, his face like that far away from me, and my body is just like this ball of heat, and I'm trying to keep it together while being really sick. And I just remember his face over the top of me, just practically spitting at me. How dare you? How dare you say that about me? How dare you? And I just remember feeling, I've got to take control here. I've got to de-escalate this because he's not going to. He somehow took from my question that I was already summing him up, which in a way sort of told me, his defensiveness kind of told me all I needed to know. I have seen these little microaggressions in hospital settings before. I've experienced them before, and in my previous job I've listened to many stories from other people that relate exactly like that. It's nothing you can pinpoint and hold down to say he definitely had these feelings towards me. But when you're a minority and you experience these microaggressions constantly, you know them, you feel them, and you see it in people's demeanours with you. And he had that.
That's where we started from.
So he continued with this sort of approach for a while. He did a short, quick physical exam and said to me that sometimes, that's right, he said to me, sometimes you've just got to go through it. And I thought that was pretty weird too, because I was certainly going through it. But what level you're supposed to go through it, I don't understand. And then he left the room, and he discussed with my nurse that he would write up a Panadol and an endone before he finished his shift. She came in and told me that, and I said, when does he finish his shift? And she said 1 o'clock, midnight, 1 o'clock. At this point it was only like 11:30, and he certainly made sure that he dragged it out till he was knocking off before that came. And even that, it felt like an FU to me, you know, like, okay, he's going to relent, as if it's something to relent to, but he's going to drag it out. And my nurse certainly felt something was not right. Before he wrote that up, she went back to him to ask him to review it again, to come quicker, and she said to me that he told her to stop and don't push it. I heard you. And that's what she relayed back to me. And we had a little discussion about, I think we've got a problematic man here. You know, this is not how things should be going. And she said, this is not how it should be going. Not at all. And she said, I'm really sorry. So then my nurse came in after midnight and said that she'd got them written up and that she's going to go get them now. And we had this little hallelujah moment. At this stage, the fluids that were going into me were certainly making me feel a bit better. And the antibiotics were kicking in too, so I was becoming a lot more robust, I think. And then one of the nurses from ward came in and said that she's got my room ready, and she's coming in to take me, do the handover. And then my nurse came back and gave me Panadol and endone, and so for the last half hour of being in urgent care, I got relief. And then I was taken onto ward, where the juxtaposition between the two places was so extreme. I was treated with so much care when I was put onto ward and into my room. Those nurses couldn't have been nicer. So after that, it was a great relief to end up in Geelong and get sepsis treated, because the difference between feeling like that and not was huge. It was Christmas, so it was Christmas Day, so it had its own little impact, but for months afterwards, I just couldn't get it out of my head. I just couldn't get his aggression out of my head, but I also couldn't get why someone couldn't see someone in so much obvious pain and not treat it or not evaluate it themselves. I just couldn't understand it. It felt so wrong and unjust, and it just kept chipping away at me. And I didn't think about doing anything about it, because I didn't think anyone would listen. I didn't think anyone would believe me. It would be my word against his. I would be going up against a system, and I was unwell. So I had to recover initially and then try and get on with my life after that. And because I have this end stage significant liver disease and all that entails, it's like you have to choose what stresses to take on, because putting myself in a distressing situation can sometimes be the difference between feeling well and feeling very unwell. So I tried to ignore it, but I couldn't. And that lasted 6 months before I picked up the phone and spoke to somebody here about wanting to talk to someone about what I had experienced on that night. Well, I got reception, and I was even nervous saying I want to speak to somebody about feedback, and she asked me what sort of feedback, and I told her. I was absolutely petrified because I don't know what I expected. I didn't, maybe she would tell me to get off the phone, I don't know. But she was so lovely, and she said, absolutely, I know exactly who to put you on to, just hold the line. And so she got me onto Kelly Reynolds, and we had a chat on the phone, and I was made to feel pretty instantly that this event is worth talking about officially.
Process.
So we arranged a meeting here between Kelly and Kath Reardon, and I brought my little notebook because I feared that I would stumble all over the place. I was very anxious about coming into it because I honestly felt that I would be walking into a situation where people would be defending their doctor or their brand, and that the burden of proof would be on me, and that I would have to explain it pretty damn well to get someone to believe me. But it couldn't have been more opposite. I was treated with such great compassion, and as I told my story, even those girls teared up. And when they showed their emotion, it's like that's when I realised, that's when I felt that I had been heard.
What happened?
So at the end of the chat, because of COVID protocols, we couldn't hug, but I was reassured that this was very serious. They personally apologised as a human that you would go through that, and then as people in quality and safety for this hospital, as their representatives, they apologised for that too, for the impact that it had, the obvious impact that it had. It was a very emotional retelling the story. It's very emotional retelling the story again, but telling it for the first time was really, I had to stop a few times. But they ensured that it would be reviewed and that I would receive correspondence about that review, and if I had any issues coming up to it, that I could freely contact them anytime that I wanted, and that they would always be here for that, to if I ever felt uncomfortable again, that they would always receive me in that way, and that they would let me know how that review went. But they also said that the story would go a long way into, I guess, becoming a bit of a tool for Colac Area Health to, I guess, educate people under its roof about how these sort of things can happen, how they get dealt with, how they are responded to, and the outcomes. And it became very clear to me that my well-being was paramount, not theirs. I'm more than glad that I followed through. It was nerve-wracking, it was a bit anxiety-inducing, but I couldn't have been made more welcome. I couldn't have been heard clearer, and I have come away feeling that I've not only addressed this one event, but over the 30 years of having a virus that I got when it didn't even have a name, and all the microaggressions and overt aggressions that I've received in hospital settings in my adult lifetime. This was not only dealing with that singular event in December, it was going a big way into dealing with a lot of those ones in the past, all the ones that I had never officially addressed, that I'd wanted to, that had built up in my head of, damn, I wish I'd said something. I wish I'd had the confidence to say something. That now at 57 and in 2021, I could not let it slide again. I just could not let it slide. And to be received and heard is the most powerful healing thing that you can offer another human being.